Good evening, and thank you for joining us tonight for Family First Health's Let's Talk Health Community Q&A. My name is Anika Jackson, and I am the Vice President of Diversity, Equity, and Inclusion here at Family First Health. Tonight's conversation is the fourth in our Let's Talk Health series, being brought to you by Family First Health in collaboration with our partners at the York NAACP and WellSpan Health. Let's Talk Health is a series presented by Family First Health to engage various communities in candid conversations and knowledge building around topics related to health. Through Let's Talk Health, communities are connected with healthcare experts like the one joining us tonight and are able to ask their questions and get real-time answers to enhance health understanding. We're calling tonight's session our 2021 COVID-19 wrap-up. We know that COVID-19 continues to impact us in so many different ways. We're using this time to share the most up-to-date information we have and answer your questions about the most pressing COVID-related issues as we close out the year. And that could range from boosters to variants to pediatric vaccination. So I invite you to share this event on social media using the hashtags, hashtag Let's Talk Health FFH and hashtag FFH. To get us started, as I do with all of our sessions, I'd like to give us some background information, a lot of data, just so that you understand as a community where we are with things related to cases and vaccination. Going into 2022, we will have been living through the COVID-19 pandemic for almost 2 years. March will be 2 years for us. And we know that there are ripple effects of the COVID-19 pandemic for our families, schools, businesses, and our communities at large. So I encourage you to think about some of this background information and start coming up with your questions and putting them in the chat along the way. So getting into the basic information in terms of case rates. As of noon today, Pennsylvania has had close to 1.9 million confirmed and probable COVID-19 cases and 35,418 deaths due to COVID. There have been more than 78,000 confirmed and probable cases in York County and 1,148 deaths in York County. When we look on the pediatric side, across Pennsylvania, there have been close to 114,000 cases for ages 0 to 9 and close to 227,000 cases for ages 10 to 19. In York, there have been 4,781 cases for ages 0 to 9 and 9,900 cases for ages 10 to 19. So we are continuing to see our numbers climb from month to month. In terms of hospitalizations, unfortunately, we're trending in the wrong direction there as well. Our hospitalizations are on a steady climb. As of yesterday, December 19th, the moving average for the past 14 days for hospitalizations is 865 for South Central Pennsylvania, which is 66% higher than this time last month. And to give a little context to that, our moving 14-day average peak for hospitalization was 938. So compared to our 865, which is current, and that was December 31st of last year. So year over year, we're still not in a good place. And based on data from our partners at WellSpan earlier this month, when we look at hospitalization, 88% of patients hospitalized for COVID-19 across their 6 acute care hospitals were unvaccinated. 92% of COVID-positive patients in their intensive care units were unvaccinated. And 93% of their hospitalized patients requiring ventilators were unvaccinated. So, vaccination matters. And speaking of vaccination, let's get into our vaccination rates. Pennsylvania has administered more than 16.5 million total vaccination doses, and that includes first doses, second doses, and boosters. Of those, more than 6.8 million residents are fully covered, with 2.1 million having received booster doses. As we break that down a little bit more demographically, across Pennsylvania, 38% of African Americans are fully covered, and close to 47% of our Hispanic population are fully covered. To bring that down, for York County, more than 550,000 total vaccinations have been administered across first, second, and booster doses. And we have more than 230,000 residents fully covered. In York, as we look at the demographic, the racial and ethnic demographic data, 36% of African Americans are fully covered, and 44% of our Hispanic population are fully covered. Something that's been a hot topic here lately is pediatric vaccination. Across the United States, nearly 20% of children ages 5 to 11 have received their first dose of COVID-19 since it first became available at the beginning of November of this year. According to the Pennsylvania Department of Health, pediatric vaccination for ages 5 through 11 from November, the beginning of November until now, we have vaccinated 354,467 children across Pennsylvania, and that represents about 20% of our pediatric population, ages 5 through 9. And then in York, that number is close to 8,000, representing only about 10% of our pediatric vaccination, ages 5 through 9. So we are seeing some gaps as we look at our numbers, and we'll talk about that a little bit more tonight. The last point I'll get into is vaccine supply and access. And as with our last session, vaccine supply in York is stable, being offered by various healthcare providers and pharmacies in our community. I want to highlight, and this will be highlighted later, our York City vaccination clinic at Family First Health on George Street, which offers walk-in and appointments for ages 12 and up. And for ages 5 to 11, we offer appointments for pediatric COVID vaccination. We have appointments available through Family First Health and also through WellSpan, through various means, online scheduling and calling in. And as an organization, Family First Health continues to work hard to meet our communities where they are. Our mobile vaccination unit has been very busy getting into our communities in York, Adams, Lebanon, and Lancaster counties, and really meeting people where they are. So that was a lot of information, but really felt it important to get us all on the same page about where we are related to COVID-19 in our area. So now that we've set some basic information out, we are excited to have Dr. Patel with us this evening, Dr. Hetal Patel. Hi, Dr. Patel, welcome.
Hi, thank you, Anika. I'm glad to be here.
I'd like to do a little introduction for you, Dr. Patel. I know that sometimes that becomes a little overwhelming. Yes, this is you. So Dr. Patel joined Family First Health in December 2016 and practices at our George Street Center in downtown York. She received her Bachelor of Science in Biology from the University of Maryland in Baltimore and her Doctor of Medicine degree from the University of Maryland in Baltimore as well. She completed an international elective at how do you say that, Dr. Patel?
Gandhinagar.
Gandhinagar, and I had practiced that too. Gandhinagar, India. She completed her family medicine residency at University Hospital's Case Medical Center in Cleveland, Ohio, and a preventative medicine residency at Oregon Health and Sciences University. Dr. Patel received her Master's in Public Health and Health Management and Policy from Portland State University. And at Family First Health, Dr. Patel has been one of our main go-tos for everything COVID. Since the beginning of the pandemic, she has been a leader through the pandemic, and I know I have gone to her personally with questions early on in the pandemic. And so I'm really excited for Dr. Patel to share with us this evening her take on where we are related to testing, cases, vaccination, and all those things. So Dr. Patel, before I turn it over to you, I just want to thank you for spending your time with us this evening and invite our audience to remember that this is your session. While we're sharing some information out, we want to be able to answer your questions. So as Dr. Patel is sharing some information with us, feel free to go ahead and chat in your questions. You can submit them via chat. We also have a call-in option. So I'm sure that what Dr. Patel shares will prompt some questions for you. So go ahead and get that started. And Dr. Patel, I'm turning it over to you.
Thank you, Anika. I'm very excited to be here tonight to engage with our community and answer questions that you guys have related to COVID. It's been 21 months and we are wrapping up 2021. So we have all been impacted in our daily lives through this pandemic, and we are not done yet, but we are closing 2021 and we would like to be done with the pandemic, but we are in the midst of it. Our healthcare system is feeling it. But I don't want to start by talking about where we are now. I would like to reflect back on what our journey has been in this past 21 months. And I love teaching. And so when I teach, I like to put things in three buckets. It just helps me consolidate information and then I can follow. So the three buckets I would put is, first, we have made such progress with testing. I remember back to earlier days when we were just going based on symptoms. We didn't have tests readily available, or even if we were testing patients, it would take 7 to 10 days to get a result back just because tests were being sent to California or to the state health laboratory, but every system was overwhelmed and it took us that long of a while to get back. Now, just thinking back to that at the beginning of the pandemic to now, I feel like when a community member is worried that they have symptoms and they want to get tested, they can pretty much get a test that day. They have multiple options, from going into pharmacies to calling their doctor's office to going into a pharmacy to get a rapid at home test. Now, the demand for rapid at home tests has been up and down. So sometimes they're easy to find, sometimes we're not easily able to find them, but pharmacies keep restocking. But it is an option that's available to many to do a at home rapid test. So essentially, when I am worried about a patient, we can generally get an answer if you have COVID or not within 24 hours. That's progress. Thinking about the millions and millions of tests that we run every day. So I think that that is a wonderful infrastructure that we didn't have 21 months ago, from inventing our tests to making sure that they're accurate to having them readily available in a timely manner. That's progress. I am very grateful today that my family, my patient, my community members are able to get a test when they need one. The second bucket that I tend to think of is related to vaccinations, right? So we sort of were thinking, we have this new illness. I've never lived through a pandemic. The last pandemic I read about in medical school was related to the Spanish flu pandemic 100 years ago. And how did we protect ourselves against flu? Well, it was vaccine, right? So we started hoping very early on, before we knew that hundreds of companies were working on vaccinations, to look at when is a vaccine going to be available so that we can protect ourselves. And I really did not think last Christmas that we would have a vaccine available. But to our surprise and God's grace and all the scientists who put their brains into it, we had a very effective vaccine options last December. And I vividly remember when Family First Health got their first shipment and how quickly we had to roll out and do it. And I thought that there would be shortage of vaccine, that our patients who needed it, it would take a lot longer. But how quickly we have moved through vaccinating our healthcare workers, to our elderly patients who were most vulnerable ending up in the hospital, to a 5-year-old who's in kindergarten can now get a vaccine in 1 year. And that is great progress for all of us. We've delivered millions of doses. We've learned so much about the vaccines, but the fact that we have options available, I just am reflecting back and I'm like, wow, I can protect my patients by offering them a vaccine. And that's what we were sort of seeing, what with Anika was sharing about the data, that 92-93% of patients who are in the ICU who need a ventilator have not been vaccinated. So if you get vaccinated, I can safely say that in realistic data, not the study data, that we can essentially protect you 90-95% of the time from being in the ICU, which is great progress, even though right now I feel like Pennsylvania is in a surge. And then a third bucket that I like to think of is treatment, right? So my patients, when they come in and they're sick, and I have to tell them, well, you have a virus and we really don't have great medicines for virus. So you're just going to have to be tough, stick it out. This is going to probably make you ill for 7 to 10 days. And that's what we're going to do. And that's what we started with COVID when it first started. However, we have made progress in terms of antibody infusions. So now when one of my patients is sick, the first thing I look at is, are you high risk for ending up in the hospital? Do you qualify for this treatment? And can we have that available to you? With our community partners, with WellSpan being one of the leaders initially, but now both of our large healthcare systems are providing antibody infusions for our patient through a referral system. I am very proud of that. Getting the antibody infusion treatment, we can keep you out of the hospital. And then very exciting, on the horizon, we have 2 oral treatments that patients will be able to take and protect themselves so that they do not progress to severe disease and end up in the hospital. So those are 3 very large buckets where we made a lot of progress in the past 20 months. And so I just want to start with that to say that I am grateful when I look back as we're wrapping up 2021 to say how far along we have come along in this pandemic.
Absolutely, Dr. Patel. We have made a lot of progress, and I recall the same when we got our first shipment of doses back in December, and it was kind of unexpected, but super exciting, and everybody felt like, Christmas came early,
Yes.
um, because that was really awesome for us to have that opportunity. So, Dr. Patel, we do have some questions that we hear frequently, and I'd like to start with a couple of those. I see some coming in through the chat, and so I'll start pulling those in as well. Um, in terms of cases, Dr. Patel, what has been the impact of increased cases on the healthcare system? I gave those data points about um, our partner at WellSpan and unvaccinated, the, the incidence of unvaccinated in the different areas. Can you talk more broadly about the system and the impact?
Sure. And again, I'll try to put it in a general terms, but the pandemic has been a strain on our healthcare system. As a country, we weren't prepared initially to deal with it. I think that we have recognized our healthcare workers and given them titles of being healthcare heroes. However, the pandemic has been very stressful. Many healthcare workers have decided to leave the industry because of the stress of it, but those who are continuing to serve our healthcare industry now, the increased rise in number of cases is leading to, and I'll start with, primary care. So where I practice, we are getting more phone calls. We don't have a number of appointments to see everybody who is sick. So if we sort of say, if the primary care system is overburdened, where do we go? Our patients then look to an urgent care if they're not sick enough. And I have noted that providers and healthcare workers serving urgent cares are seeing double, if not triple, number of patients in their shifts. And that is exhausting to wait to serve. Even patients are feeling that, right? We're used to going and it's supposed to be a quick service. And now we have to wait. We have to wait to be evaluated. We have to wait to be seen. And that's creating a lot of stress. That fuels into our emergency departments. So when you're sick enough, if you need oxygen or you're worried about your breathing, or we think that you'll need more tests, we send you to the emergency department. Or if you just can't get seen in the urgent care, you end up in the emergency department. And there we have absolutely seen that the burden of pandemic, the number of patients who are sick, the protocols that they have to follow has impacted longer wait times. I personally have had patients tell me that they had to wait 7 hours at the ED before they had to be seen. Personally, today we had a patient who was in the emergency department this morning, waited a couple hours and was not seen by a provider. They felt upset and then they left. They still have a need to be evaluated in the emergency department. So leaving did not help the situation, but our emergency departments are overburdened. When our emergency departments are busy, there are sick patients that have to be admitted, especially COVID patients, but in general, those patients who also were not able to manage their chronic health care in the interim because they were anxious or fearful of the pandemic, not going out to pharmacies or not making to their doctor's appointment. So we're seeing a higher hospitalization rates. And you shared some numbers about our local impact of hospitalizations, but definitely our hospitalists, our inpatient doctors are strained because the number of beds being occupied by COVID patients have gone up. And then our ICU demand, right? So we have only limited number of ventilators and ICUs, and they're constantly busy, right? So I think that what I feel just as a primary care doctor is that everybody in the system wants some relief, some break. And we are not there yet. We are feeling the pain. This is the burning phase if you're used to work out. And I hope that some relief is on its way in terms of vaccination or number of cases going down, so we can sort of just have a breather, because this is impacting other healthcare like planned elective procedures. So when our hospitals are at capacity, they have to sort of postpone elective surgeries so that staff or beds or resources can be consolidated.
Yeah, it's definitely, we talked about the ripple effect of the pandemic. And I think what you articulated there is there's a ripple effect in our entire healthcare system, not just related to COVID, those elective procedures being put on pause.
Yes.
So one of the topics that is as a hot topic right now is boosters. And I actually saw one of the questions come in related to boosters. So can you give us just kind of a quick rundown about boosters and what we need to know? Who needs them? How much protection do they really provide? Why are they important?
So I would say more than ever, the protection from boosters is much needed. I think that the earlier studies, when they came out, we had identified our vulnerable populations who needed boosters. But as the recommendation stands today from CDC and adopted by ACIP, is that everyone who's 18 years of age or older qualifies for a booster, regardless of which original vaccine they had. We have our mRNA vaccines or our Janssen vaccine. Everyone needs a booster if you're 18 and older. And just recently, we have gotten an approval for our 16 and 17-year-old patients who are only eligible for the Pfizer vaccine right now. They too are also eligible for their booster shots. So everyone above age 18, if it has been 6 months since your mRNA vaccine, Pfizer or Moderna, you are eligible for a booster and you should get a booster. If you got the Janssen vaccine and you're older than 18, 2 months after your first shot, you're eligible for a booster and you should get your booster dose. And then same goes with the time interval for our 16 to 17-year-olds. 6 months after their original Pfizer series, they are eligible for their booster.
Okay, that hit one of our questions that came in. So boosters are important, right?
Absolutely. If we're going to get to variant, talking about it, our immunity to any vaccine over time goes down. So all of you are aware, every 10 years we have to get a tetanus shot. Every year we get a flu shot. So every vaccine is different, but we expect that our immune titers are going to go down with time. And there's different types of immunity, humoral and cellular. But the idea here is that with 2 doses, originally in the pandemic, we had great protection, but the virus started changing. And as it changed and time lapsed, our immunity started going down. So getting booster, we are getting our titers way back up. So especially against Delta, we're getting it to that 95% effectiveness. But even with the new variant, some data are showing that if we are boosted, our immune system response, even with all the mutations that this new variant has, we're getting about 75% protection. Now, this is preliminary data, but that's really strong confidence I have in the vaccines that it is truly protecting us against severe disease. So with any patient, I can tell them more confidently that if you get your booster, you're going to be protected against ending up in the hospital or ending up in the ICU, which is very important because, at one point I would like to touch on breakthrough cases. That's very different, but the vaccines were originally studied to see, will they keep us out of the hospital? And they do, even against this new variant.
Okay. One of the questions that came in, and we will get back to the breakthrough cases, Dr. Patel. One of the questions that came in was, people are looking everywhere for information about which vaccine is the best, and there's a lot of information out there. So, what is your recommendation in terms of places to go to find the best source of truth to determine which vaccine is best? Best. Best.
So, so I will definitely say that the CDC's website for me is my go-to. I have lots of organizations that I subscribe to that I trust, but information is always changing every week. So
Mhm.
to say that every organization is going to stay on top of it, or if we produced a resource for patient that that's going to be updated, I worry that that might not happen in a timely manner. So till this day, even in an exam room, I tell my patients, okay, let's put CDC COVID-19 booster. Here's the site that came. Let's look at this table. You are eligible. So I use it as a teaching resource. I use it as a resource for me if I need to be updated on any information or any new changes that are coming along. But if you truly put CDC COVID-19 boosters, the first hit that you get is CDC's website. And it takes you to a really nice web page that has a great table that is really easy to read. So I really recommend everybody to stick with the CDC's resource. Obviously, if for any patient due to language barrier or something else, more information is needed, then we do go to specific organizations that have improved visual aids that we can use as reminders.
Okay. So let's talk about the breakthrough cases because that's something that I have been hearing has people questioning, well, do I even need to be vaccinated or do I even need to get a booster? Can you talk to us about breakthrough cases and what that is and the impact of that?
So I will start by saying, just as a member of the community, not as a healthcare professional, the first year of the pandemic before we had vaccine, I literally just prayed that God, please don't let me get sick, right? I don't know what COVID's all about. I don't want the long-term symptoms. I don't want to be sick. I want to be available for my patients to take care of them. But it was truly just the fear of getting the infection and ending up in the hospital and being very sick. However, when vaccines came around and we got this, oh, they're 95% effective and they're going to keep us out of the hospital, it was great. But very quickly, just like any consumer, we turned to the next best thing that we wanted. So if the vaccines are so great, then they'll prevent infection. Well, vaccines were never studied to prevent infections. Vaccines were studied to see if they help with severity of illness, morbidity, and mortality. Vaccines are almost 100% for preventing death, and they're 95% effective originally to the first two strains to hospitalizations. And the vaccines have held up their mark on what they were studied for. But I think as Americans, we have extrapolated to very effective vaccines being, I will not get the virus. The vaccine cannot prevent you from getting a virus. That's dependent on our habits. So if I'm not wearing a mask, it's Friday evening and I want to go to a crowded restaurant, I could get exposed. And it is possible, depending on how long I'm sitting at the table, how far I was from that individual, that I could get the infection. So when you get an infection, I do not look at that as a failure of vaccine. I remind my patients that vaccines are to keep you, right? So yes, you got the infection. Did you end up in the hospital? No, I did not. But why did I get the infection? And I said, okay, well, let's look back. Who did you get into contact with? Where did you go? What were you doing? Oh, yes, I went out and I asked, what's our second layer of protection right after vaccines? Did you wear your mask? Were you wearing a mask? Oh, no, I wasn't. So I think that we have to remember that breakthrough infections, we are going to see them. Vaccines do not protect against breakthrough infections. But in my medical experience thus far, breakthrough infections, for most part, have been milder. So patients who have gotten sick, even after being vaccinated, they get cold, flu-like symptoms, but they have not ended up in the hospital. I do know of a couple of patients after being immunized who have ended up in the hospital. And they had other health conditions that put them at
Mm,
risk, that allowed them from beginning to not have a same kind of immune response to the vaccine, just because of their own health and condition and treatment factors that impacted the response from the vaccine. But I tell everyone proudly as a family doc to say the vaccines are working. You should
mhm.
get them. And if you had a breakthrough infection, things have changed. But let's understand what is a breakthrough infection and what does that mean for moving forward for our behavior change.
Right, right. And, one of the questions that I have heard from people who have been vaccinated and may not have gotten a booster, if you have a two-dose series, let's say you have a breakthrough case, do I need to get a booster? Right? I've heard that question because, for some, they think, oh, I have this boosted immunity because I have had the infection. And so part of what I heard from you earlier on is boosters are important. How many times can we say that? Boosters are important, even if you've had that breakthrough infection after a two-dose series.
So I will share a story with you, and hopefully this will stick to our audience. I had a mother who child got COVID. She could not understand if the child, it was a child who could not be vaccinated because they were under the age of 5. Why did they get COVID again? And if we have natural immunity, if we got the
Mm,
infection the
mhm,
first time, and if our body had immunity, why did my child get COVID a second time? Because the variant is changing, right? So for a patient to tell me, I had COVID, I don't need to get boosted, or I took my 2 doses and then I got COVID, so I don't need to get boosted. And I tell them, would you like to get sick again? Because we saw with the wild type variant, we saw with the UK variant, and then we saw with Delta variant that people can get reinfected. And hopefully the reinfection is not as severe. But in order to prevent a reinfection, we need our immune system to be boosted every year, like how we boost our flu shot. So we don't know that yet, that we will need to be boosted every year, but thus far into the pandemic, I think it's important that we remind everyone that even if you had an infection or you had 2 doses, you still are at risk from getting sick from a Delta variant or getting sick from the Omicron variant. And so getting your booster and mounting those immune titers up so you have
mhm,
maximum protection is very important.
mhm. Yeah, I want to hit one of the questions that came in because you touched on masking earlier. And the question is, I'm interested in hearing about what type of mask we should be wearing. Should there be a shift away from cloth masks to KN95s or N95s?
So I will definitely say that originally in the pandemic, we did not have enough resources and we adopted the cloth mask because that was the best thing that we could do to protect the entire country. However, we are not in a shortage right now. So when patients ask me, I absolutely tell them that a surgical mask is highly protective compared to a cloth mask. And then, especially an N95, if you have access or you can afford it, it's also more protective compared to the surgical mask. So when I have to go see a patient with COVID, I will wear an N95. Um, I think that when patients have that available to them, if there's a family member who's positive and isolating in the home, I tell all my patients, please, as soon as somebody has symptoms of COVID and are getting tested, one, they should be isolating even though we don't have results. And two, even if you're vaccinated, every family member should be masking and not the cloth
Mhm.
mask. If you have access, please use the surgical mask. It's more protective. So, yes, if you have access, I encourage everybody to be using a surgical mask over a cloth mask.
Okay. Someone had chatted in earlier, and I think this was when you were talking about the impact of COVID across the healthcare system and how some people have perhaps delayed care for other chronic conditions. And they was just expressing that concern about the long-term impact to those who are delaying care based on, what you shared. Maybe it's something related to my diabetes that I'm needing care in a short time frame, and my ability to get access to that care is now delayed. So I don't know that it was a question, but more of a comment in response to what you had shared earlier.
I think it is really hard to balance what the demand is for and then what is the
Okay.
right thing to do. I want to remind our patients, our community members, that if you call in and the doctor is not able to get you in as quickly as possible, or because you're scared, ignoring your health is only going to have those ripple effects of your health deteriorating. So we do have to prioritize. Just because we're in a pandemic, we cannot neglect our preventive health nor our chronic diseases. So, as hard as it sounds, we have to make time for it. We have to engage with our healthcare providers and prioritize our health. Because if you protect yourself against COVID, but you neglect your diabetes, and
Mhm.
then you have consequences of neglecting your diabetes, that's not going to end up in a great place for you, for your overall health and quality of life. So, I think it's important that we start to integrate our health into the pandemic and keep prioritizing our preventive and chronic health along with being protected against COVID-19.
Yep. Can we go back to variants? A question that, as you were talking about reinfect, someone getting COVID twice, and it might be due to a different variant. Can you talk a little bit about why we are continuing to see these different variants come out? When we saw, the different variants and then Delta, it was like, oh my gosh, brace for impact. And we actually started getting to a better place with Delta, recognizing how the vaccines can protect us. And now we have Omicron, and that's what we hear everywhere we turn, right? Omicron. Why are we continuing to get these variants?
Great question. I think that we forget, but it is the science of biology that things evolve. So, 21 months ago, we had a new virus that made its way to humans and it started getting us sick, and we were never exposed to it before. So, everyone was getting sick quickly. And then it changed a little bit. And then we had that UK variant. And we were talking about, when that came to US, that's what we were seeing. And then later we had the Delta variant, which originated in India, but then, globally, everywhere in the world, it spread and it was more contagious virus. It was more transmissible. So it had its own advantages to outwinning all the other variants, which is what it did in the United States. That we essentially, for the last 6, 7 months, we're seeing that 96 to 99% of cases in the United States were due to Delta. And Delta was winning thus far until Omicron came and it has all these mutations. It's still relatively new, but based on what limited science studies have been done, we understand that it is more transmissible, it is more contagious, and it's replicating and duplicating twice as fast as Delta was doing. So we're going to see areas where we have lower vaccination rates and crowded events and where people are not protecting themselves, that this will give a niche to the Omicron variant to spread quickly. We have hotspots in United States, like in New York or Texas, where the Omicron variant is spreading quickly. I think that it has the potential to spread and really give a great competition to the Delta variant. And it could overpass it or not. We don't know, only time will tell. But it is just the biology that the virus is trying to survive. So it has changed. And as a result, each time it has a significant change, we are still susceptible to getting sick again from the variant. And I think that when we don't know about something, it makes everyone anxious. It's just human nature. And so everyone wants to predict the future, wants to prepare us, and so I think that's why we're hearing, what will Omicron do? What is the future? What is the impact? Are we protected? Do we need to have newer therapies? Do we need to have newer vaccines? Everyone wants to prepare, and that's why we constantly hear about it. But, like as of today, when I last checked, 96% of COVID cases in Pennsylvania are still due to the Delta variant. But
Mm.
that does not mean that in future, in 2 to 3 weeks or 2 months, that that's going to be our reality. But the great thing is that our government is using resources to type the virus. So we know where all the states are. And when
Mm.
Omicron is tipping the balance, and that's what we're seeing, we're going to be able to go to CDC's website and look at that and better prepare.
Yeah, a question I contemplated asking is, can we expect more variants?
Yes, I think that when Delta was 99%, I really thought, you know what? This is the winner. This is the king. The
Right.
game is done. This is where we're staying.
Yeah.
And then how quickly information changed and how quickly Omicron started to spread and the impact that it is having in United Kingdom, it really has made me reflect that anything is possible. I would not look any family member, patient, or community member in the eye and say, okay, we're done. We've seen the worst. You can't say that with this pandemic. So, yes, anything is a possibility. But right now, it seems like Omicron and Delta are the two main ones that are competing.
Well, let's hope that we can just say that these are the winners and let's call it done. Can we?
I will pray with you that I hope that we can get there. I don't
I
want
hope
any
we
more
can get there.
surprises.
Right, right. So I want to shift our focus a little bit, Dr. Patel. We touched on a little bit earlier pediatric vaccination and the data around, and we were talking about this just this morning, the pediatric vaccination numbers, about 20% across the state, and actually that holds true across the United States, 20%, but in our local service areas, about 10, 12%. Can you tell us a little bit more about your thoughts behind pediatric vaccination and considerations that parents should have in making that decision?
Sure, absolutely. So I before I answer your question, I'm just gonna interject a comment. When you look at those Pennsylvanians who have decided to get immunized against COVID-19, and if you look at that by age breakdown, we
Mhm.
will see that our 75-year-olds or older patients have been 95% immunized, right? And as we go down decade by age, we're seeing that as we get to the younger people, we have a lower and lower uptake of vaccine for whatever reason, right? And so I think that originally what we have seen throughout the pandemic is that adults and those with chronic conditions are ending up in the hospital. And we emphasized that, and we had a great uptake in those individuals.
Right.
But our young, healthy college students, they weren't getting vaccinated until
Mhm.
colleges started mandating it, or we started hearing about outbreaks in college campuses. But I think that, we started talking about if your child is in college, they are in that setting, they're coming home for Christmas, right? If they are exposed to the virus and then they're going to be having that Christmas dinner, that holiday dinner, or time spent with their grandparents who are in their 90s or 80s, that's a real risk, right? And so
Mhm.
we started making movement with our 18 to 25-year-olds, sort of getting more and more immunized, which is wonderful. I still think that there's room for improvement, but I think that that's great. But because the younger kids have never ended up in the hospital, I
Mhm.
feel like we sort of want to be extra cautious and know everything about a vaccine when we talk about kids. But over time, we have seen as the variant changed, kids are getting more infections. All of our states are now reporting a number of kids who have infections.
Right.
I have personally seen school closures because of outbreak in classrooms. I have seen schools needing to convert to remote learning as a result of it. So I truly think that there is an impact on child's education. There is an impact on parents. And there is a
Mhm.
true risk of this very rare disorder called MISC. So only kids who have gotten COVID, a few weeks later, they get sick and they get very sick where they have multi organ failure. They end up in the ICU. I don't want a single child in the United States to die of MISC. But our risk with COVID-19 infection and pediatrics has gone up with variants and with going back to school and being in a setting where children are being exposed to each other. So we know that kids are as likely transmissible as adults and that they can get sick and then they're out of school. So there's an impact on parents and the child. So I try to frame it for families who come to see me to say, did you have your child vaccinated against flu or pneumonia, right? The pneumonia series in children, we do it starting at age 2 months. and we start immunizing to keep them out of the hospital. Well, I have seen kids with COVID end up in the hospital. So I ask parents, what is a priority to you? If you want them healthy and safe in the schools, then a vaccination for me is a no brainer for a child. I think originally, when we didn't have a whole lot of data, I had parents telling me, well, they only studied this in 3,000 kids. How
Right.
do I know that my kid is going to be safe? But look at now, we've administered 16 million doses of pediatric vaccine. So I think that we have a lot more data with VSafe. And we know that our checks and balance system is working, right? So when we do hear that there is this rare side effect, myocarditis. We were seeing that in the adolescent and the young adults. And we were worried about that. But the CDC was able to give us real time data saying, are our kids between 5 and 11 at risk for myocarditis? What is the dose of the vaccine? It's 3 times less. And so far, of all the doses that we've administered, some communities have had a better uptake of the pediatric vaccine, but we have not seen an increased signal of myocarditis after the second dose. So I just want to reassure parents that the vaccines that have the EUA approval, the Pfizer vaccine, it's safe for children. And if my child was 5 years or older and eligible, I would be getting in line to vaccinate. So please, you can prevent hospitalizations, you can prevent infection, and you can prevent delay in their education, their routine. So please get your child vaccinated. And if you have more questions, talk to your pediatrician, talk to your family doctor. We have information available, and we'll be glad to talk with every single one of the parents.
Yeah. Well, and you hit on something that's really important in two different ways, the ripple effect. If a child comes down with a COVID infection and then is with the grandparents, right? The opportunity, the unfortunate opportunity for spread there, but also, the being out of school and the impact on the parent or guardian who needs to then take off of work, and then is that student learning, and so and then the socialization of it, which we're hearing a lot about, related to the students who did virtual learning last year and then came back into the building, and the mental health implications. So it is really weighing out, as you said, weighing out which would you prefer for your child. And so I appreciate you reiterating that for us tonight. Dr. Patel, we are getting close to time, but I do have two final questions for you. The first is, and this was actually chatted in, we're in the midst of the holiday season. And for many people, we know that that means gatherings, with family, friends, and, just really enjoying time together. And for those who are vaccinated, we think, right on, I've gotten my booster. What is your recommendation going into the holidays for us to keep in mind to keep ourselves safe and to keep our family and friends safe?
So I will say, as much as we would like, we don't have a safe zone yet. So I think it's very important for us, being second year into the pandemic. I am not recommending for any of my patients to completely avoid socialization, but I am asking them that you have to be smart and you have to plan, right?
Mhm.
So talk to your family members. If you have unvaccinated family members who are not masking and are exposing themselves, then is it safe for the family to come together, or should there be a divided dinner, right? Sort of thinking that probably will give you the most protection. If you are already vaccinated and boosted, but there's risk that you cannot avoid, like you have a 3-year-old who goes to a daycare, or you have a 5-year-old who goes to kindergarten that has not been vaccinated yet, then based on the amount of time that we're spending indoors because it's cold out, are we masking, right? Are the grandparents going to be with the kids the entire time? Or are we going to ask them to only come a couple hours before, but be able to hug the kids, eat with them, share the gifts? So
Mhm.
I think that we have to plan accordingly. I think that everyone is smart and data is so easily available. We have to look at what's happening around our communities, our county, our zip codes. If the rates are high, you might choose, well, this is not the best week to get together. Or instead of having one large family gathering, we need to have 3 individual ones. And I would start with the riskiest first, right? So if you have to visit your elderly grandparents or your parents, start with that first before you expose yourself to many other people, and then move on to your friends or your cousins or the young folks that might have more exposures. So I think that if you are planning, you are masking, and you're asking about vaccination and boosters, I think there is a safe way to gather this holiday season, but it might just not look like everything that we can do.
Well, and I have to use this analogy because I've heard it so much throughout the pandemic, the Swiss cheese approach, right? You know, the vaccination, the masking. There's no one, I heard someone say there's no one way out of the pandemic. Vaccination is a huge one, masking is a huge, but it has to be layers.
Absolutely. I feel like it's just not one. When we look at our resources, it's multiple things that we have to use, right? So if somebody's been exposed, as much as you love them, they do not
Right.
come to the event, right? If somebody needs to quarantine, there's a reason why we have those guidelines. And we love that family member, but we can't just sort of say, you were vaccinated. And so it's been 5 days. It's okay if you come to the family gathering because everyone else is going to be exposed. We really don't have great data on how long you're contagious. We know that it's
Right.
reduced compared to unvaccinated, but I think we still have to take all the precautions from masking, isolating, distancing, following quarantine guidelines. And honestly, if you have folks traveling, then using the rapid tests to travel and use. I feel like if there's international travel, the PCR testing is mandated. But I honestly will recommend friends and family, if you have access to a rapid test, get tested before you get on a flight, get tested after you get off a flight. So you really know that the family members that you're spending time with, that at least that day you were not sick, that you were not bringing the virus to them. Sometimes it takes a day or two for symptoms to appear, but at
Mhm.
least we recommend, if you have access, repeated testing if you're going to travel and be exposed to individuals and you would like to keep your friends and family members safe.
And we did just share in the chat, you mentioned the rapid test, and I know we spent some time talking about that earlier today in a meeting, Dr. Patel. We did just put in the chat about a quick how-to video on how to administer. And, you know, Dr. Patel, when we were talking in preparation, we were talking about the access that exists, and you had mentioned that in your introductory comments, access that exists for those at-home rapid tests. So those can be a really big tool for us.
Absolutely. I feel like many things in science, we don't have at-home rapid tests other than, figuring out if we have a UTI if you're a female. But I absolutely think that, we can do a strep test at home.
Right.
We can do a urine pregnancy test, but that's a wonderful advance that allows us to act quickly, right?
Hmm.
I tell families, like, why invest in $25 if you're going to tell me that I will need a PCR test later? And I explain to them, if you have the rapid test available, and if your family member, loved one, or your child spikes a fever in the middle of the night, you're not going to get a PCR test in the middle of the night, right? So,
Right.
one, you can test. Two, you can start to isolate them. And if one parent has to be, or one adult has to be a caregiver to that person, then at least you can protect the rest of the family and you can sort of say, we are isolating. So I absolutely think that there are definitely positives to investing and planning and having a rapid test available if you have access to it. And I am very excited about the link you put in because I feel like patients sometimes are scared. They don't know, what if I miss a step? So if they look at that video and they know how to do it and the test is readily available to them, you're more likely to use it.
Yep. Absolutely. And then my last question for you, what is the one thing you want everyone who is on this session tonight to walk away with? If they've heard nothing else from you, the one thing you want them to walk away with?
I would like for all of us to give the gift of life. Okay. So when I really reflect back in this entire 21 months, I think of what puts somebody as the highest risk of dying in this pandemic. Last year, I remember watching news and names of everyone that we've lost to COVID, families who have lost multiple family
Mm-hmm.
members. But it was heartbreaking to see how many people we have lost to this pandemic. If I can do something in my power to save a life, which I can, that thing is get vaccinated, right? So if that is the one message that you can pass along to any loved one, to say, this is not about what we know and what we don't know. We truly are in a crisis, and a way out is together. So we have to stay
Mm,
together and follow the science and say, I will get vaccinated because I can prevent one person from dying. So I feel like that if you think that you're young, fit, and healthy, and you go to the gym 3 hours every day, that's wonderful. But you can give a gift of life by getting vaccinated or convincing someone who's not vaccinated to get vaccinated. So boosters are great, but the best impact we have is from that first dose of vaccine. We need that to happen. And then we need to follow the recommendation to get the second and the booster dose when it's time. But getting vaccinated saves lives. I believe in it. I have faith in it. And we have science that has put data and information at the tips of every American to say, this is not some test trial that we're running, but we have evidence where it works. The Pfizer vaccine is FDA approved. We've given so many millions of doses. So the information is out there. Please use it. Convince people to get vaccinated. I think that that is the biggest impact that we can have as a community in our way out of this pandemic.
final words. And being holiday season, I love how you frame that. It's a gift, and the way out is together. And I think that's part of what the challenge has been, is recognizing that we all have a role to play. So thank you, Dr. Patel, for sharing your time and your expertise and knowledge with us tonight. And thank you to everyone who took the time to tune in to tonight's session. We have shared a number of resources in the chat throughout the session. So if you want to scroll back through, that will be there for you. We also have some other resources to share related to all things COVID vaccines, how to find a provider if you're looking for a vaccine provider. Of course, we have our York City vaccination clinic at our George Street site, 116 South George Street in downtown York. But if for some reason you're outside of that area, we will share in the chat how to access that. The final thing I will say is we'd love to hear from you about how tonight's session went, and potentially other topics that you want to learn about. So there will be a survey in the chat, and it's only 4 questions. So please take 1 minute to let us hear from you, so that we can make sure we continue to provide relevant information to our community. So thank you again, Dr. Patel, for joining us tonight. And thank you for everyone who took the time to learn more and hopefully take the opportunity to share this information with others. And so, as Dr. Patel said, give the gift of life this holiday season. So good night and have a happy holiday. Thank you for joining us.